of both patients and families. I also recognize how essential is to involve the patient in talking therapies combined with medication. At the end of the presentation, participants should be able to define bipolar disorder. Especially, we'll describe the symptoms of bipolar disorder and the type of bipolar disorder, and describe the importance of managing bipolar disorder with psychoeducation. We'll discuss about medication and talking therapies such as psychotherapy's approach and psychoeducation. Bipolar disorder, according to DSM, is a mood disorder, sometimes called manic depression, causes extreme shifts in mood, characterized by alternating periods of mania, hypomania, and depression. Especially people who have it may spend weeks feeling like they're on top of their worlds before plunging into a deep depression. Male and female approximately equally, affects approximately 2.8% of adults. Most commonly, bipolar disorder began in late adolescence or early adulthood, and the exact causes of bipolar disorder is not known, but it is believed the results from multiple factors. Genetically, there is a link between a family history at the condition and an increased risk of developing bipolar disorder, with studies suggesting up to 10-fold increase in risk in a first-degree family member is affected. It's important to highlight it's not social factors such as use of illegal drugs, as well as stressors like relationship difficulties or financial challenges may also contribute to the risk. Here in the diagram, you can observe the range of symptoms associated with bipolar disorder. Especially, the green line showed the average mood, and with purple, the bipolar 1 and bipolar 2. Most people experience normal ups and downs, but with bipolar disorder, the range of mood is greater than normal and often more extreme. Okay, let's define the symptoms of depression according to DSM-5. Low mood, anhedonia. Anhedonia means a loss of interest in previously activities, sleep disturbance, feeling overly tired during the day and sleeping longer than usual at night, or taking frequent nap, diet disturbance, low energy, experiencing low energy levels that may even make getting out of bed too much, psychomotor retardation, inappropriate speech, decreased concentration, and thoughts of death. In severe cases, there can also be thought of death and suicide. Diagnosis of major depressive disorder typically requires 5 of the above symptoms that last for at least 2 weeks. All right, the symptoms of mania or hypomania involve feature of an abnormally elevated mood. Mania is more severe, impairs day-to-day functioning, and may include psychosis, which can lead to misdiagnosis as schizophrenia. According to the DSM-5, the criteria for mania include at least 3 of the following symptoms: diminished need for sleep, feeling rested after only a few hours of sleep, sense of grandiosity means the people believing oneself to be superior or better than others. Pressure speech, people speaking rapidly and excessively, racing thoughts or ideas, experiencing a fast and continuous flow of ideas, distractibility, difficulty focusing due and being easily drawn to unimportant or irrelevant stimuli, increased goal-oriented activity, means engaging in excessive planning or activities with high energy, and excessive pleasurable activities, including in risk behaviors such as overspending, excessive sexual activity, or gambling. For mania, these symptoms must persist for at least 7 days and be severe enough to impair normal functioning or pose a risk to oneself or others. Hypomanic episode share similar symptoms but are less severe. They must last a minimum of 4 days, be observable to others, not causes significant impairment in functioning. Okay. Based on this, there are 3 types of bipolar disorder. Bipolar I disorder, this can be diagnosed with a single episode of mania, as it is assumed that a depressive episode will eventually occur. Bipolar II disorder, this involves at least 1 depressive episode and 1 hypomanic episode without a full manic episode. And cyclothymic disorder, sometimes considered a mild form of bipolar disorder. This involves periods of depressive and hypomanic-like symptoms that do not fully meet the criteria for a major depressive episode or a hypomanic episode. The management of the acute phase and long-term stabilization in bipolar patients who face an increased risk of suicide involves a combination of pharmacotherapy and talking therapies such as psychotherapy and psychoeducation. There are several types of prescription medication for bipolar disorder. These include mood stabilizers, which are the first-line medications that help prevent episodes of mania and depression, as well as antidepressant and antipsychotic medication. During periods when individuals are not experiencing manic or depressing phases, they typically take maintenance medication to prevent a relapse. Talking therapies play a crucial role in the treatment of bipolar disorder, complementing medication management and helping individuals better cope with their condition. Here are some of the most effective talking therapies for bipolar disorder. The main goal of psychotherapy is to help individuals understand manage their emotions and understand their emotions, develop coping strategies, and improve interpersonal relationships. Psychoeducation aims to provide individuals with knowledge about their condition, including recognizing early warning signs and understanding the importance of treatment adherence. It is important to highlight that two approaches can effectively complement each other. Regarding the type of psychotherapy and based on evidence, the cognitive behavior therapy is considered the gold standard of therapy for bipolar disorder. It aims to help individuals to identify then change negative thoughts patterns and behaviors and recognize triggers for episode. The number of sessions required for cognitive behavior therapy to show effectiveness varies depending on the patient's psychological profile, severity of symptoms, and the specific condition being treated. For example, mild depression may show improvement with 6 to 12 sessions. More severe depression may require 12 or more sessions to achieve significant results. After that, dialectical behavior therapy was developed for borderline personality disorder, but has adapted for bipolar disorder treatment. It focuses on emotion regulation. And interpersonal and social rhythm therapy is specially designed for bipolar disorder and focuses on regulating daily helps to individual to involve the quality to improve, the quality of own life. According to effectiveness for cognitive behavior therapy, here you can observe some evidence supporting the evidence of cognitive behavior therapy. A meta-analysis revealed that cognitive behavior could reduce the relapse rate. At one similar with first study show, the results show at 6-month follow-up, cognitive behavior therapy show a 51% reduction in relapse rate, and one more study show patient who receiving cognitive behavior therapy showed a 35% reduction in depressive symptoms. Let's now see what is psychoeducation. Psychoeducation for bipolar patient is an important component of comprehensive treatment that aims to equip individuals with knowledge, skills, and confidence to effectively manage their condition. Psychoeducation aims to equip individuals with bipolar disorder with the knowledge and skills necessary to take an active role in their treatment, enhance their ability to cope with the illness, and ultimately lead fulfilling lives despite the challenges associated with condition. The number of sessions required for psychoeducation for bipolar disorder to show evidence are 10 to 12 sessions. Psychoeducation can be delivered through various formats such as individual or group-based sessions, and in some cases it may involve technology such as a mobile application or website. The core components of psychoeducation include illness education. This involves providing patients with accurate information about bipolar disorder, including its symptoms, causes, and treatment options. It helps patients better understand their condition and make informed decisions about their care. In self-management skills parameter, including teaching patients with strategies to monitor their moods, recognize early warning signs of episode, and develop effective coping mechanism. Techniques may involve maintaining mood diaries, action plan for managing symptoms. Medication management. This parameter involves educating patients about their medication, including their benefits, potential side effects, and the importance of adherence of medication. Such education helps to improve treatment, compliance, and overall outcomes. Lifestyle management. This involves encourage healthy habits such as maintaining regular sleep patterns, engaging in exercise, and practicing stress reduction techniques. These factors play a crucial role in promoting mood stability, and overall well-being of patient. And relapse prevention includes techniques for recognizing early symptoms in patients to help prevent a full relapse episode. Okay, at the parameter self-management skill, the parameter self-management skills, it's also crucial for bipolar patient, and including techniques such as mood monitoring. This parameter including techniques for tracking moods and events over time, possible thoughts keeping in a diary. Lifestyle management, including continuing education on the importance of regular sleep patterns, physical activities, and a healthy diet in managing bipolar disorder. At parameter stress management, including techniques for identifying and coping with psychosocial stressors that can trigger episodes. And the parameters routine maintenance include counting and understanding the benefits of maintaining a regular daily activity patterns, including eating, sleeping, and physical activities. Another important topic include in psychoeducation program is social and occupational functioning. This parameter including themes such as relationship management, this including strategies for maintaining healthy relationships and communicating effectively with family and friends. Occupational considerations, this including guidance on managing work responsibilities, including recognizing when it may be necessary to take a step back from work during episode, and decision making, this including the parameters such as understanding the importance of avoiding major life decisions and during manic, hypomanic, or depressive state. At parameter stigma and empowerment includes parameters such as empowering patients to manage social stigma and stereotypes. Psychoeducation programs should include parameters that empower patients by providing tools and knowledge to address both self-stigma and social stigma associated, of course, with bipolar disorder. The psychoeducation programs should also focus on fostering self-esteem, promoting personal empowerment, and supportive, proactive help-seeking behavior. According to the evidence, psychoeducation empowers patients to take an active role in their treatment, improves treatments, adherence and outcomes, helps patients recognize early warning signs of mood episode, reduce stigma and promotes self-advocacy, and the last, enhance overall quality of life and functioning. Talking therapies is crucial because it's a cornerstone of patient-centered care of several reasons. First, empowerment for manage the bipolar symptoms and engagement with treatment plans, improve health outcomes, well-educated patients tend to have better health outcomes and are more likely. Enhance patient satisfaction. Patients who understand their health conditions and treatment options report higher satisfaction with their care. Cost effectiveness, especially educated patients are less likely to require unnecessary test or procedure, potentially reducing healthcare cost, continually of care and personalized care. Okay, let's review 3 quotes from lived experiences shared by patients who have participated in psychoeducation programs. The psychoeducation helped me a lot to understand and accept my illness. It's very important for me the combination between medication and psychoeducation helped me to accept the medication, and sharing my story with others in the group not only helped me, but it also felt good to know I was helping someone else. The takeaways for today are: bipolar disorder is a complex chronic condition requiring comprehensive management. Integrate treatment approach combining pharmacotherapy and psychosocial intervention yield best outcomes, and patient education and self-management strategies are essential components of care. Here are some references. Thank you so much.